Hi, welcome to today's podcast. If it's your first time tuning in, my name is Soliman, and I am the founder and the CEO of the Accreditation Council for Medical Affairs, or the ACMA. And while I typically explore advancements in healthcare, medical affairs, and reimbursement and prior authorization, today I'm going to address an issue that affects millions of patients and providers as well who care for them, which is namely prior authorization. Recent headlines regarding the murder of UnitedHealthcare CEO Brian Thompson have brought attention to the challenges surrounding this process. A system designed to ensure that patients receive the right care while controlling costs. However, we must acknowledge that for many, prior authorization has become a source of frustration, fear, and even harm. For patients, the delays caused by prior authorization can mean waiting weeks for critical medications or treatments. For healthcare providers, it means spending hours navigating the administrative hurdles instead of focusing on patient care. And for payers, the challenge lies in balancing the need to manage costs with also at the same time ensuring access to medically necessary treatments and their responsibility to shareholders. No one enters this system hoping to create barriers. Patients seek care to improve their lives, and providers fight for their patients' health and well-being. And insurers ultimately aim to ensure resources are distributed responsibly. Yet somewhere along the way, the system has become a flashpoint for misunderstanding and, unfortunately, mistrust. Our organization, the Accreditation Council for Medical Affairs, or the ACMA, is deeply aware of these challenges. As a neutral and independent accrediting body dedicated to advancing medical excellence and training field reimbursement and prior auth professionals, we work with all parties, patients, providers, insurers, and policymakers to bring about meaningful change that we feel can help our society overall. Our focus is on solutions that enhance transparency, streamline processes, and prioritize, most importantly, patient outcomes. By leveraging education, fostering collaboration, and aligning on evidence-based practices, I believe we can reduce unnecessary delays and ensure that patients have access to the medicines and treatments they need when they need them. We must also acknowledge the human impact of this issue. Let's face it, behind every statistic is a mother waiting for medication for her child, a provider fighting for a life-saving treatment, or an insurer trying to protect the system for future patients. So these are all factors that we need to think about. Ultimately, each one of us has a role to play in creating a more compassionate and efficient process. Now, this work isn't easy, and it won't happen overnight. But together, we can rebuild trust, improve care, and ensure that the health of our communities comes first. Thank you for listening. To learn more about the work that the ACMA does and some of our initiatives, visit us at acmalifesciences.org and share your story. Leave a comment if you've been impacted by prior authorization. Let's continue this conversation and take steps towards a healthcare system that works for everyone. Thank you. And until next time, I will see you guys soon. Stay well.